Hello, I would like to begin by going over this consent form with you for this clinical trial that we have decided to invite you to. With this clinical trial, you are going to be assisting us in trying to find ways for a more effective treatment of ulcerative colitis. You will undergo treatment for 12 weeks with this clinical trial. Okay. The purpose of this trial is for those within the criteria while also suffering with active ulcerative colitis to be assigned to a different group within the trial. There will be a placebo group and a group that will receive the drug. Each patient will not be aware of the group they are assigned to. Throughout the study, pharmacodynamics and pharmacokinetics will also be monitored. Some of the procedures include screening assessments to determine whether you qualify for the study, review of your medical history, medications, and ulcerative colitis history. You will also undergo multiple physical examinations and vital sign checks. You'll have blood and urine testing, which includes safety labs, pregnancy testings, things like that. Stool testing or disease activity assessments will also be required. Endoscopy or other assessments used to evaluate ulcerative colitis are required throughout the study schedule. Monitoring during and after infusions for possible reactions or side effects will also be required. Throughout this trial, you should expect it to begin the third quarter of 2017, and it will extend all the way until the first quarter of 2020. So this trial will be about 2.5 years for you. Within that 2.5 years, you'll be asked to come back 8 different times just to go over vital signs, updated on your treatment and things like that. Some of the risks that we would like for you to be aware of are side effects from the placebo, and they are unknown because the drug is still currently being studied. You could have some infusion-related risks, which could include IV infusion risks like shortness of breath, chills, rash, itchiness, dizziness, fever, or other symptoms. Drugs that affect immune or inflammatory pathways may increase the risk of infection and make it harder for the body to fight infection. So that's another risk that you could be undergoing. Possible changes may include changes in blood counts, liver enzymes, lipids, or other abnormalities that require monitoring. You could also have some procedure-related discomforts like bruising, bleeding, dizziness, or infection. IV placement may also cause discomfort or irritation at that site. Some of your ulcerative colitis symptoms may not improve because you are unaware of what group you will be added to, whether it's the placebo group or the treatment group. And so then they could just not improve, or they could worsen, or they could just continue to be normal as is. You also undergo some pregnancy risks if you are pregnant. Like, you need to take some precautions, because it could cause some risks to the fetus. And then there's one more privacy risk where you could have a loss of confidentiality, even though all of your records and things like that are going to be protected, but with the clinical trial, it's not guaranteed. With that, I would like to also go over some of the potential benefits for you too. Some benefits that you could have is just a update in your ulcerative colitis and improvement. Throughout the 12-week treatment period, you should receive benefits from the administration of the placebo in this study. At the end of the trial, all patients for their ulcerative colitis at the discretion of the investigator. This research also Okay, sorry. This treatment could also be effective for those with ulcerative colitis, obviously, and then those that suffer from Crohn's disease as an alternative to some of the other drugs that they undergo. Do you understand everything in this clinical trial?